Next presentation is by Dr. Wang. He's from from Boston actually, and he'll describe some very interesting new results to us.
Wait, okay, good. The most common death cause of the Barth syndrome is cardiomyopathy, and so far there's no targeted therapy. So the goal here is to find this kind of therapy in the mouse model. And okay. The pioneer work tells us induction of TAS deficiency is sufficient to cause the cardiomyopathy, and there is clear heart dysfunction in the mouse model after, I think, after 7 or 8 months induction. But there is still some little bit limitation of this model. The cardiomyopathy is mild, and it needs over half of a year to develop the phenotype. So we do some of modification of the protocol. First, we put the dogs into drinking water for the mice, and we start the induction of dogs as the birth. And more important, we just do the separate analysis of the of the homozygote and the heterozygote, and also we do the separate analysis of the different genders, that the male and the female. We do the separate analysis. And we found, and in the female homozygote, the survival rate is lower than the wild type or other groups. And then we look at their heart function, and we can begin with the female side, and compared to the wild type female, the female homozygote has a dramatically lower level of the fraction shortening, which is the marker of the heart function. The higher, the better. The lower, the worse. And the heterozygote of the female mice have the little bit lower of the heart function, but comparable to the wild type. And the male sides also have the same pattern, but we, for unknown reason, we got a very low number of the male homozygote, and we are in the process to analyze why. So if we use the 40% of the fraction shortening as a cutoff for the normal and abnormal, we found in the female homozygote groups, we have the almost 60% of the mice develops the very clearly heart dysfunction. And the male, we have the half of them. The problem of the male homozygote is that with the number of the mice is very low. So the next question is that we already got the cardiomyopathy and within 8 weeks by the induction of the dose. So next question is, do this kind of the cardiomyopathy be reversed? So we do a very simple experiment. We just withdraw the dogs to see what happened. It turned out, and when we withdraw this group is dogs off group. We withdraw these dogs at the 8th week. So after 8 weeks of the dogs, the heart function seems like come back towards the normal. And this is just the preliminary data. We are in the middle of the large number of the work of this kind of research. But currently, I can report, pretty sure we got some of the good pattern of this dogs withdrawal experiment. And in the dogs induction groups, the heart function just go worse. That means the Barth syndrome is progress. And dramatically, and the pathological basis for this heart dysfunction we found is that come from the fibrosis of the heart. And the red one means the fibrosis. The more red, the more fibrosis. So after withdrawal of the dogs for 8 weeks, we found the fibrosis coming towards the normal. So that's make us to think maybe this kind of the disease phenotype is reversible, and there maybe a drug that can do the same thing as the dogs withdrawal. So, and before we go to the Bendal, we have a little bit of a summary. So we found that we can got the cardiomyopathy phenotype in the mouse model within 8 weeks by the induction of the TAS deficiency. And this disease phenotype seems like can be reversed, so justify we further efforts to find the drug or the other replacement therapy. So we just get involved the work of the Bendavo with that steel company, and the protocol is straightforward. We just use the separate the mice into two groups. One is use the Bendavo treatment. Another is use the saline as the placebo. So we want to see what's the effect after treatment of this drug. And here is the plan we want to do. Basically, we just group these mice, build on their genotyping, homozygote, heterozygote, and build on the genders, male or female. And here's the goal number we want to pursue. And currently, we have some of the data come out. So we do not finish of them all, and we are in the middle of the get them all. That we got some of the preliminary data now. So this picture is pretty busy, but we can see here is that as I have said, we have two groups. One is the treatment group, another is the placebo groups. So we can see here, and this is the female homozygote with the treatment of Bendavil, and this is the treatment group, and this here is the is female homozygote with the placebo, and the y-axis is the marker of the heart function. As I said, the higher the better, the lower the worse. And the x-axis is the time point, and here is earlier, here is late. So the red rectangle just show the point of the heart function. You can see in the placebo group here, lots of the mice have the worsening heart function, especially for this one, they just literally just die. And the majority of them have the trend to go down, go down, go down. And in contrast to this, in the treatment group, you can see here, majority of mice that come back to normal, at least towards the normal. And one exception is here, and they just get a little bit worse. And majority of them is come back to normal. So this preliminary data just encouraging, and we were in the middle to get it more, to overcome some of the variation of the existing in this treatment process. And here is a good summary of this data. You can, here is the spot just means the mice are in the treatment groups, and the blue spot just means the placebo groups. And here is the average of the heart function. You can see after treatment, this is the time point. Again, this is the heart function. At the time after treatment, and the heart functions come back to at least towards to the normal level. That's very encouraging. And at the pathological level, we can see after, I think this is 4 weeks treatment of the Bendavil, the fibrosis, as I mentioned before, there's a little bit come back to normal. And what I want to point out is that in the clinic, one of the hallmarkers of this patient is in the children's heart patient, they receive a new heart. And we have a chance to get their slice of their heart. We can see there's very clear the fibrosis. At this time, the blue one, I think, is means the fibrosis. And the red one is the blood, I think it's the heart muscle. So the more blue, the more fibrosis. You can see very severely fibrosis in the patient. So that is one of the major reasons they receive the new heart. So I think we have a very good model to mimic the human heart disease, human Barth syndrome disease. And these symptoms can be reversed at least at the mouse model. And Bendavil is a very good potential drug for the treatment of Barth syndrome. And here we just see the Bill, my boss, to support and supervise all the work. And Ye is the person who responds for the mouse work and do a lot of the historical work. And Chin just do a lot of the echo. And there's the other lab mate in our lab just to do a great help for this work. So I'm very happy to take any questions.
Thank you very much, Dr. Wang. Questions?
Nice work. So I'm wondering, what strain of mice you use for this experiment? The reason I ask is because originally when we tested, we found the homozygous 100% lethal. So we cannot get homozygous task mouse to test. So we have to settle with the heterozygous. And I contact the company, which is
Jackson Lab.
No, it's original company, Takana Artemis. They made this mouse, and I think they also said this is homozygous lethal. And I don't know what's the experience with Zaza and with the Barry. And in your lab, do you have a homozygous task?
No, we maintain them as a heterozygous, I believe, because we also never got a homozygous.
Jen, did you want to make a comment?
Mine are also homozygous lethal.
Yours are all what?
Homozygous is lethal.
Homozygous is lethal, yeah. Okay, questions? Yeah.
There's a question here, Matt.
Hi, I have two simple questions. The first is, how do you treat your mouse model?
Can I just answer his question
I'm
first?
sorry.
Yes.
I'm afraid I forgot your question.
Just do what the chair
Okay.
Okay, let's go ahead to answer his question. Or okay, basically I used exactly the same mouse, and we come from that company you described. Exactly the black mouse, and it's I think it's B65 side or something that I need to check. But I'm sure it's exactly the same strain of the company. And I also read the original paper. They say they cannot survive any of the homozygous. But the thing is that it turned out when I crossed them, I just can't got some loss of the heterozygous. But I do not got a very, I cannot see any male homozygous. But I see a reasonable amount of the homozygous of the female. So we found they have, within 8 weeks for the homozygous, they have very clearly phenotype because obviously they have two bad guys, right, two allele. So the mice may be more sensitive to the task deficiency. So.
Okay, there's a question here.
So two simple questions. First is, how do you treat your mouse? Injection or feeding? And the second question is, how long did you start to observe the changing phenotype after treatment of mouse? Like how many days or months?
Okay, and the treatment, the way if you're asking for the Bendavir, right?
Yes.
So
Bendavir.
basically we put them into a small pump. The pump is kind of like a sponge. They can release and fix the amount of the liquid during the time. So we can make full use of this. We load the pump of the mouth of the Bendavir we want to get in.
Oh, so it's from drinking.
It's not drink, it's a small pump. It's kind of like a sponge. Yeah. And then we put them on the skin of basically it's cutaneous to put them under the skin of the mice.
Oh.
And the pump is kind of like a sponge. They can release of the liquids and at the same amount of the time. So we just put in the relevant calculation. We do the math, right? We just let the pump to release out the suitable amount we want them suitable. So in other words, these mice just expose the constant concentration of the Bendavir. That is our goal.
Mm-hmm.
So.
And how long did you start to observe the changing phenotype after treatment?
Yeah, the original plan, we try to do the 6 week. So the 6 weeks ending point, we just try to see something, if we have some of the effect of the treatment, we use the 10.3 weeks. So basically, we have 2 points. 1 point is the 3 weeks treatment, and the second is 6-week treatment.
Okay.
And maybe if we have more funding or something, maybe we can some of long term, but that is our original. But we found within 4 or 5 weeks, we can observe some of the effect of the treatment.
Okay, thank you very much, Dr. Wang.
Okay.